Hi everyone, how are you? How's your skin? So just wanted to hone in on a question that's asked very, very regularly of me. Um, and I think this is a really good platform to actually clarify. So, do fillers have a place in aesthetic skin rejuvenation treatments? Yes. Short answer, yes, absolutely. So the reason why I talk a little bit more about all of the other treatments and less so about botulinum toxin and hyaluronic acid dermal fillers, because those are the types of treatments that you are probably expecting more information about because of the way the industry is and because of the treatment menus available in the other clinics. So I do implement these treatments. I do it in a slightly different manner. So the main focus of my mission is to improve your skin health in a more natural, in a more conservative manner, and in the process of which you are able to achieve natural and longer lasting results because your body is actually more involved with the process of the rejuvenation, therefore producing more skin cells or stimulating the hair cells, etc. So with regards to fillers and botulinum toxins, so more known as the anti-wrinkle treatment options, they absolutely have a place within skin rejuvenation. They absolutely have a place within the aesthetic industry. So, with regards to a lot of skin rejuvenation treatments, you are not going to see immediate results. That's not the plan, that's not the objective. It's for you to see longer and more natural results. So it's going to take some time for your body to actually kickstart the process, and therefore it's going to take some time before you start to see these results, or the results become visibly more noticeable to you. With regards to filler, you are going to see more immediate results. So I particularly like the role of these agents in areas where we have lost volume. So particularly as we age, it's going to happen. As we age, the everything starts to resorb. So everything starts to shrink in size, and that includes our bone. So our facial structure, our skull, everything starts to get a lot smaller, and therefore the prominent features, your cheekbone, your jaw, your chin, everything starts to resorb in size. So you start to see this very central droop of your skin because there's less support from the bony structures. And that's where filler comes in really nicely. It actually recontours your bones so that it can become a little bit more of a supportive structure, stretching out the skin. Not in a natural manner. I understand how that sounds, but very much so. If your bone structure is resorbing, you have less support. Your skin is going to start to look more droopy, more saggy, and so by re-establishing those bony contours, you can use filler to actually structure them along the bone. So again, it can look very, very natural. Does not have to be overtreated or overfilled. I think I've made this very clear in all of my other videos, but you can use that to very subtly re-establish those bony contours, to restructure and support all of your skin tissues. Therefore, we don't have as much of that dragging or the drooping and saggy outlook. That's where fillers come in really, really nicely. The other area that I'm a big fan of with regards to fillers is actually under the eyes. So I talk about a lot of alternative treatment options because it's a very daunting process to have some injectable treatment in and around the eye area, and fillers don't exactly have the best media exposure with regards to this particular treatment. So a lot of patients are not so keen to have fillers at all. That is the reason why we have invested time and effort in learning and establishing ourselves within other treatments that are available around the eyes. So I talk a lot about peels, microneedling, polynucleotides, but fillers are the only agents that will actually restore volume in that area in a more immediate manner. So if you have, as we age, we lose the fat pads around the eyes, they drop. So you end up having a little bit of a shelf between your lower eyelid and your cheekbone, and the only way is actually injecting the volume into that area to replace the lost fat pad. Everything else that we talked about will bring about some sort of improvement with regards to volume, but not enough for some of the patients. So for everyone with tear trough defects or dark circles, it's really important that you're actually assessed correctly as to what the causative factor actually is, and then to be advised according to that as to what treatment is going to be the best option for you. So fillers absolutely have a place. Now, botulinum toxin, that's another thing altogether. 100% has a place. So I am a big fan of botulinum toxin. I am not a fan of the frozen look. However, by reducing the activity of some muscles, you can actually prolong the results of some of your more natural rejuvenation. So it actually works really nicely as a complementary technique to relax the muscles. So everything that you are doing in terms of rejuvenation, whether that's treatments, whether that's home care, your botulinum toxin, a brand name is also Botox, in case you aren't aware about the component within that agent. You can actually relax the muscles so that the aging process, the wrinkle effect, is all very much delayed, and therefore the results of your rejuvenation treatments and home care are prolonged. So you see the results for a lot longer. I absolutely am not anti-filler. I'm not anti-toxins. With regards to these injectable treatments, I've received some very funny DMs whereby they said, how on earth can you be anti-filler? I love it. I'm not anti-filler at all. So fillers are really good for patients that are aging, that are looking to regain that youthful appearance. The one that I have completely forgotten about is lip fillers. As we age, our lips do become thinner. You can use Botox and botulinum toxin and dermal fillers to actually reestablish the shape of your lips, so they do look fuller, plumper in a very natural way, so that you actually restore that youthful appearance within your face, to restore the proportions of your face, really. So that's a lot of information. If you have any questions, then do let me know. As always, it's really important to book with a professional who is willing to listen to your concerns and your expectations, and to create a bespoke plan for you specifically. So you know where I am. Book a consultation, send me a message, anything you need, and let's have a chat. Let's have a chat about you. Have a great day.